guidelines, but I didn't.
Well, you might as well just go ahead and get started. I don't know if we're going to have more people trickle in or not. So thank you all of you that did join tonight. Thank you, Dr. Carlson, for joining us as well. This is just kind of going to try and be mostly a Q&A session, but I'll let Dr. Carlson kind of open up with any standard answers that he would have ahead of time. But if you do have questions for Dr. Carlson, please enter them into the Q&A section, and then I will pose those to Dr. Carlson so we can try and get you the best answers that we can about the vaccine, whatever questions you have, getting it, concerns about it, whatever that is, and then we can try and answer them the best as we can. So I don't know, Tracy, did you want to say anything to start, or?
Yeah, I would like to recognize and thank Dr. Carlson for his work in providing information. I know he's done this numerous times this summer, and we appreciate it. Also, Eric and Brad, thank you guys for working so diligently to get the program set up as well. The NCAA came out last week with the SSI guidelines for fall sports. We are committed to following the guidance that was presented to us, and we've worked out a plan to be able to do that. There is a difference for testing requirements for student athletes and staff that are fully vaccinated, as well as unvaccinated individuals as well. And currently right now, our community transmission is in the high category, which we do antigen testing, requires us 3 tests a week for our department to be able to do that. And that is for anyone that's unvaccinated in that tier 1 group. But as you can see, we do have different parameters. We certainly understand people's choices with the vaccination, but we also have to follow guidelines through the NCAA, and that is our plan moving forward. And we've started that this week with the sport of football. So with that, I'll turn it back to you, Eric. Thank you.
Sure. So Doc, do you want to just kind of start us off with just I mean, we've done this before, so the kind of general questions about the vaccine. Is it, where is it at? Is it safe? Where is it at with FDA approval? Kind of the general answers as why we would encourage our student athletes to take it, and any generalized concerns of why people wouldn't want to take it.
Yeah, so maybe I should just disclose that I do not have any financial interest in vaccinations. I don't get paid for anybody getting vaccinated. I don't get paid by BSU. I don't get paid to be here tonight. This is just, I want to see healthy athletes have successful seasons, and if you want my short answer, I think the evidence suggests the best way to stay healthy and have a successful season is to get vaccinated. The vaccine is approved. It's approved for emergency use. So this is one of the questions people have. There's concern that maybe it's experimental. It is not experimental. As far as we consider medicines to be experimental, it's been approved. It has gone through a rigorous process that includes not only the manufacturers doing studies, laboratory studies, animal studies, human studies, collecting data, and measuring both the effectiveness. Does the vaccine work? Does it prevent disease? Does it keep people healthy? And is it safe? Are there complications or side effects? And all of that work was done. It was done quickly, and that gives people some pause. They think, well, if it was so fast, maybe they cut some corners. They didn't cut any corners because of the obvious immediate threat of the pandemic. What they did instead was they did all of those steps as much as possible in parallel. And then, as you can imagine, instead of going through a slow, methodical, take wait your turn process for the FDA to come to your vaccination and discuss it, and then maybe wait for the next quarterly meeting to discuss it and approve it. Instead, everybody was primed and ready to go. As soon as the data was available, the experts were convened, they met immediately, they weighed the evidence, both FDA experts and an independent panel weighed the evidence and considered the evidence for safety and the evidence for efficacy, does it work? And they didn't have any hesitation to approve each of those vaccines that are available now. Primarily in the United States, as far as I'm aware, we're getting the Pfizer vaccine and the Moderna vaccine. There are a few, I think, Johnson & Johnson vaccines, but mostly Pfizer, Moderna, I think, still. Just so you know, the vaccines, the last number I've seen is there have been 350 million vaccines given in the United States. So this is a huge number of people. That's not an experiment. That's a huge number of people. 350 million vaccinations in the United States. Across the world, 4.5 billion doses of vaccination have been given. 4.5 billion doses. And that's a huge number. Unfortunately, it's not enough. Experts have suggested somewhere between 70, 75, 80, 85% vaccinated to get to a level where we can kind of pause and take a breath and say, okay, maybe we're over the hump in terms of like immunity in the community. Minnesota's a little bit ahead of the curve. I think the whole state's about 57%, but the United States in general is only about 50%. And so we're not close.
One of the more common questions that we get in the athletic training room is from females, fertility questions. There's obviously the question out there, and people have suggested that this may cause infertility. Where does the evidence lie with that?
Yeah, that's a common question. Obviously concerning. That would be huge if we were worried about fertility. I'll give you a couple answers. One, there's no evidence that these vaccines have any effect on fertility. In fact, none of the vaccines that are available for use today, including the COVID vaccines and any of the other ones, have any evidence that they are affecting fertility. So this is just not a vaccine issue as far as we've known since we've been doing vaccines. I don't know where it came from. I do know that infertility questions came up around vaccines before. There have been issues with vaccination hesitancy around fertility questions in other countries that have really led to some unfortunate epidemics in local areas because of the concern about infertility. The American College of Obstetrics and Gynecologists, this is the national professional organization of the obstetricians, the gynecologists, the people who take care of women and women's health, they recommend the vaccines. They do not think there is any evidence that it is affecting fertility at all. In fact, if you are a woman and you are interested in getting pregnant now or in the future, they say get vaccinated, because although the vaccine does not have any evidence that it could affect fertility, what could affect fertility is you get really, really sick and you have some other kind of complication from the infection. We don't know what happens then, because some people get deathly ill and have severe complications. For this reason, women who are wanting to get pregnant are encouraged to get the vaccine. Women who are pregnant now are encouraged to get the vaccine. Again, we have no evidence that it affects pregnancy. 35,000 women who were pregnant when they got vaccinated were looked at and followed. There was no increase in complications among that group of women. And so again, the American College of Obstetrics and Gynecologists say, we don't have any evidence of complications with the vaccine. We know if you want a healthy baby, the last thing you want to do is get COVID. So get the vaccine even if you're pregnant. Breastfeeding mothers are encouraged to get the vaccine because they can actually pass on some of their antibodies through the breast milk, potentially protect baby in that short term. So basically everybody's encouraged to get the vaccine. On a personal note, my family's vaccinated. I have a 17-year-old daughter. She's vaccinated. I have never had any thought that it could at all affect her fertility. So I don't think that's a very significant risk that women should worry about.
Good, thank you. Another question that I get fairly often is, I've already had COVID. Why would I want to get the vaccine? Aren't I already protected?
Right, so that's a great question. That seems like a natural thing, right? If you have a virus and you're infected by the virus, then your immune system is going to respond. It's going to help you. So the next time around, you will be immune. And that may be true, I think, is the answer. The problem is, although the vaccines have been tested and studied and compared with placebos to see, do people who get the vaccine have better protection from a serious infection and illness than people who get a placebo? We have not done the test where we see people who have been infected, are they still protected better than people who have not been infected? And so we don't know that. And it's kind of hard. That immune response to an infection is a little bit less standardized, and it's a little bit harder to know exactly how was your infection. Like if you get a vaccine, it's the same dose. Everybody gets the same dose in the same spot. It's very regulated. We can compare results. Some people had infection, they didn't even know it. Other people had very mild infection. Some people obviously were hospitalized and serious illness and complications. And the amount of immunity that might come out of those is potentially different. That seems to make sense. So the recommendation is, again, even if you had the infection, you are recommended to get the vaccine because we know the vaccine works, and we don't know if you had the infection that it works. We know that it's safe. We know it's safe if you had an infection and you get the vaccine, then you shouldn't have any additional side effects or complications than other people. And so it's just useful. On a practical matter, all of those people that you hear on the news and the places that you hear on the news about checking for vaccine status and wanting to make sure you have proof of vaccination, none of them are taking proof of infection. It's just not going to pass muster with them. And it won't pass muster with the NCAA either.
Thank you. Another one that I hear fairly commonly is we have certain people that feel they don't trust the vaccine because they feel like it's being pushed on them. A lot of governmental policies, NCAA policies, state policy regulations now. University of Minnesota is pushing it on, and people feel very untrustworthy of a vaccine that's being pushed like that. What's kind of the response to that?
Yeah, I think that's fair. I don't like to do stuff that people tell me I have to do. Makes me wonder why they want me to do it, and I think it's reasonable to question their motives. I think this is an excellent point, right? It matters who is doing the pushing and why, and I think that matters a lot. And what I would do is I would flip that on the other side and say, well, let's consider some of the people who are saying don't get vaccinated. What are their motives for telling you that? What are their potential benefits to having you stay unvaccinated? What's in it for them? And if you look at the CDC, if you look at the FDA, if you look at some of these professional organizations like the American College of Obstetrics and Gynecology, the American Academy of Pediatrics, the American Academy of Family Medicine, the American Medical Association, you go down the list, these organizations, they don't gain anything. Nobody's paying them. They're not getting money from any vaccine manufacturers, and certainly individual doctors aren't getting paid by vaccine manufacturers. That's just not true. The people that I know, that I listen to, are people that are interested in individual health, and they're interested in the public health, and they're looking at the data, and they're trying to figure out what's best for everyone, what's the best thing they can do for everyone. And I think it's right to push, because this is a situation where my personal choice does have an effect on Brad potentially, or on Eric, or on Eric's children. And so Eric's children aren't eligible to get vaccinated, so the only way we can help Eric protect his children is if we all get vaccinated. And so it's really not even a personal decision in that sense. It's a it's a community and a group decision. It's a team thing. We got to pull together for the team, and some parts of our team need others of us to step up and do our share. I think that's a helpful way to think about that. There are obviously a lot of conspiracies and conspiracy theories, and I have not found any to be credible. I would be happy to look at data if there was one, but I've not seen anybody that can show me anything that's credible from my perspective. So I think the reason we feel a push is because there's a legitimate health need, and the public health experts and physicians and parents and everybody that wants to see everyone healthy and safe is going to tell you straight up, I think you should get the vaccine. And might feel pushy, but it's in your best interest if you ask me. So I think if it's in your best interest, I might give you a little push.
Another one that's come up fairly recently for me is not necessarily about getting the vaccine, but how you should feel around people who are not vaccinated. So people concerns about moving in with a roommate that's unvaccinated in the dorms, or treating teammates differently that are vaccinated, unvaccinated. Should I be willing to be around my teammate if they're unvaccinated? What are your thoughts on that?
Yeah, I mean, it gets really complicated, doesn't it? Like, well, I'm supposed to, if I'm vaccinated, then maybe I can hang out with other vaccinated people indoors and not necessarily wear a mask. But if somebody's not vaccinated, then maybe I'm supposed to wear a mask. But if we're living in the same apartment, then I don't want to wear a mask in my apartment all the time. It gets very confusing, and it comes down to some individual risk assessments and deciding what's safe for us all. What's safe depends on factors like the community. We talked about there's a little bump in the infections in our community. If you got COVID all around you, you're going to have to be more careful. You're going to have to be careful everywhere, even inside your apartment potentially if there's unvaccinated people. And all the kids are unvaccinated, so if you are in close contact with families who have kids under 12, that's potentially an area where you need to step up and be responsible. And if you're not vaccinated, either you need to stay away from them or wear your mask around them because they're not protected. And so if you don't think you need to be protected personally from the infection by vaccine, you should at least be respectful about being careful to protect those that you're potentially exposing. I don't know if you were going to get to this, Eric, but there's been a lot of talk about how someone who has been vaccinated could be shedding things and spreading that around to other people, and that's completely false. The actual little bit that's in the vial that is injected into your arm goes into the muscle. Very small amount of it goes into the lymph nodes, maybe in your armpit, and that substance that's injected is pretty much broken down in your body, probably within hours, and it's gone. It's no longer there. The rest of the process is all your own body making its own antibodies and revving up its own immune system. Your body doesn't produce that vaccine material after it's broken down. Your body simply produces the antibodies and the reaction to that. And that's not shed. So, when I have any other virus or any other infection or any other vaccine, I don't spit out antibodies. I don't spit out parts of those particles from my breath or from my skin. It just doesn't leave my body. It can't. It doesn't have that ability to do so. What can come from you is a live virus. So if you've got an active infection, you are probably spreading that. And so that's one way where the vaccine is dramatically different. Vaccine can't be spread to others. Virus can definitely be spread to others. And so, again, I think that just strongly weighs on the side of getting vaccinated.
I think that leads to another important question that gets asked is if people are vaccinated and they're still getting COVID-19 infections, what's the purpose of getting vaccinated?
Right, because it would seem on the surface that it doesn't work then, right? If you can still get infected, and the reality is, if you have been vaccinated, if you have not been vaccinated, you are far more likely to get an infection. far more likely. So in the vaccine effectiveness trials, they showed 90% effectiveness, 95% effectiveness. What they were talking about was the ability of a vaccine to reduce your risk of serious infection compared to someone who got a pretend vaccine, a placebo, or was unvaccinated basically. And so when they say that number, 90-95%, what they mean was there was still 5% or 10% of those people who got the vaccine but got sick anyway. And so there's always a small number. We don't have any vaccine that's 100% effective. We've never had a 100% effective vaccine. But it's pretty darn good. It's up there with some of the best of them that we've ever had at 90-95%. But it means that you can still have some. So if we vaccinate 350 million people in the United States, and if only 5% of them get infected, how many are we talking? I mean, we're still talking like, 20 million, 30 million people get infected. That's a huge number of infected people. But it's a small fraction of that huge number. It's a huge number, but a smaller number than the hugest number. And sure, you can get infected, but it's clear that it is still safer to be vaccinated than to be unvaccinated. You can go on the news right now, you can look on Twitter, you can Google it. If you look at these places that have had low vaccination rates, Louisiana, Arkansas, some of the southeast, the hospitals are filling up again with people infected in the Delta variant. And every interview I hear on the news, they talk about how it's a pandemic of the unvaccinated. Sure, there's a couple of vaccinated people in every one of those wards, but it is full of unvaccinated people. And by far, the proportion of people who have been vaccinated who get seriously sick is way smaller than the proportion of people who are unvaccinated that get sick. And so, yep, you're correct. You can still get sick if you're vaccinated, but it's still worth it. It still makes a difference. It has meaning. It is effective.
And I think the last big question that I typically hear, you kind of touched on it a little bit, but I'm a college kid, 19, 25 years old. My age group is not the one that's dying. It's typically the 65 plus year old population. If I'm not going to get terribly sick from it, why would I need to be getting the vaccine?
Yeah, exactly. I've thought a lot about that because I hear that too. I talk to people and they say, I'm just going to be careful. I don't think I need the vaccine. I'm not a high risk person. I don't think I'm around a lot of people. I'm just going to wear a mask. I'm just going to social distance. And the first thing I say is, really? Are you really going to wear a mask all the time? Are you really going to social distance? Is that how you want to live? And maybe they do. So what would I say to that? The first thing I would say is young people are getting sick and dying. It's not a safe disease. They are getting sick and dying. Not as many as 65 and older, but they are. And over, I think something like 500 kids under 10 have died in the U.S. from COVID. They're dead kids, and nobody wants a single dead kid. We can't protect them with the vaccine right now. The only way they get protected is if everybody else is vaccinated. So that's the first thing I would say. You're safe, that's great, do the next thing and protect the kids and get vaccinated for them. The second thing I would say is, I think I read 1,700, maybe a couple thousand, between the ages of around, I think, 12 and 17 have died from COVID. Okay, maybe you don't think that's a big number. It's a lot of dead kids. We shouldn't be losing that many for something that's preventable. If they'd had a vaccine, how many would have died? Based on the studies, almost none. So that's tragic because those could have been vaccinated. Once you get to that 18 to 30 year range, then we're talking over a couple thousand have died from COVID. This is a real number. That's way more than sudden death in athletes in a year. And we do stuff about that. We try to screen athletes, look for things like that. We got protocols. That's a real number. That's a number that we do stuff about because these are young, healthy people, and we don't want them dying. And again, potentially preventable because the risk of those people dying of the vaccine is extremely small. So the second thing I would say is, yes, it feels safe, but it's not. And if you think you're immune, if you think you're bulletproof, good for you. You're a young, healthy athlete. I get that. I was there once, and unfortunately, when you work on this side, what you find out is everybody thought they were safe right up until they weren't, and then they find out they were mistaken. So I would feel terrible if someone had an opportunity to stay healthy, have a successful season, and they didn't take it, and then they regretted it later. Because COVID does nasty stuff to people, and it would, a serious COVID infection would ruin not just your season, it could ruin the next several years for you with some of the complications that people have.
And I guess kind of piggybacking off of that complications, can you kind of touch on what you know about the long COVID symptoms, the prolonged COVID symptoms? What is that doing in the athlete age population, or have you heard much about that?
Yeah, that's a little bit of a mystery still. I don't think we understand everything going on there. There are complications from having COVID infection. If you just ask some of your friends, I'm sure they'll tell you that I've talked to athletes who lost their sense of taste for months. That's miserable. It sounds kind of minor, but that's almost torture to not be able to taste food, and that's not fun. Causes stress, it causes weight loss. You certainly can't stay very fit, and you certainly can't stay at performance level if you're not being able to eat well. Other things, there's people who feel like they've been in a fog. There's this COVID fog thing going around where people feel like their brain just hasn't recovered. They're not clear in their thinking. They're not able to make decisions clearly. They're not able to focus clearly. There is this long COVID where people have prolonged fatigue. They get spurts. It sounds like they feel better for a few days, and then they just crash again, and they can't get out of bed hardly. Sometimes they have respiratory symptoms where it's just hard to breathe, like just walking around is hard to breathe, and they don't have nearly the tolerance for exercise as they used to. You can imagine how that would be tragic for an athlete to experience something like that. And I think this just, it underlines that that question. I mean, so I hear a lot of people say, well, the vaccine is so new. How do we know that it's safe? What are we going to find out in the next 10 to 15 years? And one of my responses, yeah, and this virus is pretty new too. What are we going to find out about that in the next 15 years? I mean, I'm going to take my chances with the vaccine because I think that's got a significantly less risk of doing long-term damage as opposed to this virus running loose inside my body and causing all kinds of havoc that may have direct effect long-term or indirect effect from some of the damage that's done. So this isn't something that I think we should just ignore. It's not a little cough and a sniffle for a lot of people.
I think that the kind of last question that I've heard lately, not necessarily a question, it's more of a just a generalized fear, fear of the unknown. They feel like there's side effects, their fear of getting the side effects from the vaccine where they're perfectly healthy right now. And there's that fear of, I mean, couple of the vaccines maybe took a pause. Johnson & Johnson took a pause for the blood clots. There's the big question about myocarditis with the Pfizer Moderna vaccine. There's just kind of this general fear of what happens if I take this vaccine and I get one of these big side effects. Who's paying for that? What's the responsibility there with that?
Yeah, I think, and I think that's a great question. I think I probably wouldn't even use the word fear. I like the word hesitancy, vaccine hesitancy. I think people are not necessarily afraid. I mean, I think they just feel like they're at a point where maybe they don't feel comfortable enough to move to go with the vaccine yet. Call that hesitancy or apprehension or cautiousness or whatever you want to call it. Some people might be afraid. I don't think from the majority are actually afraid of the vaccine. And that's a tough one, right? Because we're trying to figure out how do I allow someone to vaccinate me, and if I don't feel 100% comfortable with that. And so that's a tough decision to make, right? And so then naturally you think, well, I need some information. I need to know some more information before I can be comfortable doing that. The challenge with that is, what if we can't give you that information for 10 years? What if that information isn't going to be available? The one piece that you need to be comfortable, to get off, beyond your hesitancy, what if it's just not going to happen for 10 years? Would you stay unvaccinated for 10 years? Right? And for many people, like, well, I don't think I'd wait 10 years. I'm not like, paranoid about it. I just want a little more. Well, but that little more could actually take an extraordinarily long time. Like, how do we answer this question of, I think the vaccine was rushed. I think there's going to be some more information we're going to find out later. In reality, that almost never happens with vaccines, and so it's unlikely to happen. And so at what point do we just say, okay, that's enough time, now I'm comfortable? I mean, where are you going to draw the line? Are you going to draw it 2 weeks from now, or 2 months from now, or 2 years from now, or 20 years from now? I mean, we may literally not have much more information in 2 years than we do now. So I would just kind of challenge people to say, are you really looking for an extra piece of information to convince you, or are you just kind of stuck? Like, it feels like you don't know how to make that decision with that much uncertainty. And young people, I don't want to pick on young people. I've been a young person. Young people, I don't think, have a lot of experience making decisions when there's a lot of uncertainty around the decision, and that's really hard when you're new at it. And so I would say, talk to some wise old people, like middle-aged guys and others, grandma and grandpas, and people who have been around long enough to have to make hard decisions when it's not 100% certain. And how do they go about doing that? I think that would be helpful to do. I'd be happy to talk to people if they want. But that would be one thing I would say to people. And I would just challenge people to say, what is it? Think about, what is it that you would need to tip you over to say, yes, I'm ready to get a vaccine. And if you can figure out how to voice that, and then we can work on how to answer that question, or we could decide, yep, what you're looking for isn't something that we can answer for a long time, so are you willing to move forward with some of that uncertainty or not? It's tough. It's just really hard to make these decisions. And as parents will tell you, try making decisions for your kids when it's uncertain. It's even harder. It's a challenging spot to be in, and I get that.
I think there's one other question that popped up last week when we did this with the football team. The mRNA type of vaccine and the rumors about it potentially changing DNA or how it could affect our body long term. Is there any truth to that?
Yeah, so now I get to go into the weeds of the genetics, which is fun for me and probably going to make everybody's eyes glaze over. So what's in the vaccine itself is, I'll give you the analogy I gave the football players. It is not the virus in the vaccine. It is not the spike protein in the vaccine. What's in the vaccine are little tiny pieces of molecule called mRNA. mRNA stands for messenger RNA, or ribonucleic acid. Messenger RNA. So it's got those 3 capital letters which sound a lot like DNA, and we know that they're related to the DNA, but it's actually a different type of molecule. And so mRNA is something that's naturally found in everybody's cells, and it's found, it comes out of the nucleus normally from the DNA and into the cell body, you can call it. And then that's where these other things called ribosomes, they take the mRNA and they take that and they transcribe it and they convert that into an actual protein. And then the protein is what does work and does things. And so when your vaccine injects this little mRNA into your arm, that mRNA has a little bit of a kind of a shell on it. It's little superficial shell that kind of helps it kind of stick to the cells. Otherwise, it just completely falls apart and would be useless. This is, by the way, one of the reasons why they have to be kept at such a cold temperature, because those mRNA molecules are so unstable and fragile, they just fall apart all the time. So they have to be super cold. Anyway, this gets the mRNA into the cell. Now, it doesn't go into the nucleus of the cell, which is that core of the cell where the DNA lives. The mRNA never even goes in there. So it doesn't touch the DNA at all, and it can't. It just goes into the body of the cell where these ribosomes are, and they transcribe it, and they make this protein. This protein that they are coded to make is the spike protein, but it's not even the whole spike protein that the virus makes. It's kind of a disabled spike protein, because they specifically engineered it so that it would look like the spike protein, but it wouldn't have the same effect of the spike protein. And so your cell transcribes the mRNA, makes this disabled spike protein, and then this disabled spike protein goes out to the surface of the cell, and then your immune system recognizes it and goes, whoa, what's this thing? And it starts the immune response to that spike protein. And that's what triggers the immune response, so that when the virus comes into the body and it's got its real spike proteins on it, your immune system has already seen a spike protein that looks like that, and it knows immediately, this is a bad guy, I gotta take care of this right away. As opposed to if you didn't have the vaccine and you got exposed to the virus and it shows up, then your body's gotta start from scratch, figure out, oh, wait a minute, this is not right, I gotta figure out an immune response to this, and it starts to build the immune response, but it's already behind the game because the virus is already replicating, and it's ahead of it, and by the time your immune system catches up, you can be seriously sick. So that's how it works. The analogy I gave the football players was, if you think of the virus as a single virus as the whole Statue of Liberty. So instead of the coronavirus you've seen in the graphics, you think of the virus as the Statue of Liberty. And each of the viruses is a little Statue of Liberty. What goes into the vaccine does not contain the Statue of Liberty. It doesn't even contain a part of the Statue of Liberty. It contains the instructions for the cell to build just the torch that the statue is holding up. And not even actually the torch, just the torch that looks like the torch, but it doesn't actually do anything. It can't light up, it doesn't function right, but it kind of looks like it. And so your body takes in this instruction kit, which is the mRNA, and it makes its own little kind of non-functioning torch, and then your body makes an immune response to this non-functioning torch, so that if the actual virus that looks like the Statue of Liberty shows up, your immune system goes, I don't know what that thing is, but it's got that torch on it, and it goes right into action and says, I got to get rid of that. And so it's already prepared. Essentially, the pump is primed, and it's ready to go as soon as it's exposed. So there's no way that the mRNA can get into your DNA. It doesn't get close to it physically. There's no way it can change your DNA. There's no process that allows an mRNA to actually change DNA. Your body can't do that. There's no way that even these mRNA molecules, they don't float around in your body. As soon as your cell transcribes it, it falls apart. Like it's gone. It can't even use it twice. It just disintegrates. So it doesn't spread everywhere. The actual stuff that goes into your arm is gone probably within a day or two, and the rest is just the effect of your immune system getting ramped up.
Thank you. So if anybody else has any questions, please quick type them into the Q&A. Otherwise, we'll kind of wrap it up here. Again, just so everybody knows, BSU and BSU Athletics is strongly encouraging vaccines. We're not mandating it by any means, but it is strongly encouraged, both for your personal health and for the health of those around you. And really, it helps you. It protects you from being able to have a season this year. The more people we have vaccinated, the less testing that we have to do. Likely, the less infections we will have to do. If you're vaccinated, we are not quarantining. There's no CDC is not having us quarantine anybody right now. So if you're vaccinated, you do not need to quarantine. You're not going to miss games from being exposed to others. So that's one of the biggest things is that I see as an athlete is really besides the health factor, just the fact that you don't have to quarantine anymore. So Dr. Carlson just put a couple good links in there. If you're interested in more COVID information, please take a look at those. Otherwise, if there's no other questions, Doc, Mark, I'd really like to thank you. Go ahead.
Yeah, I think one of the questions that the football players had the other day was, just concern about some of the historic abuse and racism that's gone on in the medical field and institutions, and everybody talks about the Tuskegee syphilis trials, and so I think that's a real thing, and I don't have a way to fix that, and I know that middle-aged white guy is pretty much the picture of the people that were doing that kind of stuff, so I understand if this face doesn't have a ton of credibility to speak to that, but I did look into that. I found some resources. I found the Black Coalition Against COVID.org is a group out of Washington, D.C. It's started by minorities of color, black and Latino, I think primarily, and has respected leaders in those communities who can kind of talk to that and probably do a better job of responding to some of those concerns that I don't think maybe a middle-aged white guy would have the authority to speak into.
Typical Zoom. Let myself muted. Thanks everybody for attending. Dr. Carlson, thank you again for your time that you spent talking to us and answering questions. And as always, if I have more questions, I will continue forward them on to you.
Great.
All right.
Thanks, Eric.
Thank you. Yep. Thank you, everybody.